All right. So good afternoon. My name is Ryan Wells. I am the founder and CEO of Health Here. First off, thanks to the Blockstack team for inviting us. This has been a great trip, and it's great to see all this sort of cross-pollination of folks leveraging this technology. So today we will present our platform, and it's including our soon-to-launch mobile app, ClinicQ. So Health Here is really all about taking the friction out of the health system, but always focusing on the patient first. So this all starts by simplifying how patient data is collected and shared with the providers. And by leveraging Blockstack technology, we can invent how patient information is shared and utilized across the entire system. So I'll show you that in a bit. I thought it would be meaningful to give a little bit of history on US healthcare just to get some context, and I'll do just that. So this is the number that sort of eclipses the entire healthcare debate. We spend 18% of GDP annually on healthcare spend. So effectively this year, that'll be $3.5 trillion. So that kind of sparks some questions. How did we get there? Why is it so expensive? Most would agree there are sort of three main drivers here. There's lack of transparency around pricing. There's overutilization of medication and some of the services, but maybe the biggest driver is the lack of sharing patient data. That's what really drives the redundant services, the medical errors, and the billing mistakes. So step back a little bit. Amazingly, if you just go back to around 2009, there were most of the health records in the US were paper charts that were filling filing cabinets across the US. The government wisely steps in with a $37 billion infusion and promotes the adoption of electronic medical records. This actually worked pretty well to at least create the infrastructure. So about 85% of healthcare providers have some form of electronic medical record. So we thought this would be big, right? I mean, so we're 7, 8, 9 years into mass adoption. We had high expectations that big data was going to bend the cost curve, was going to improve patient care. That hasn't quite taken hold just yet. Not to say that it won't, but without free-flowing patient data, we're just not going to get there. So we've sort of gone from the storing mode, sort of the adoption mode to storing, and now it's really time to share. So what about the patient? What's their perspective? I think it's common for most in America when they reflect on US healthcare that it's high quality, but it's expensive, it's confusing, and it's inefficient. And it's really not secure when we talk about these health records. Well, we've now counted up to about 180 million patient health records breached. So we've got some serious obstacles in this matter. So we think it's time to empower the patients with their own toolkit to navigate healthcare. So it's one that should be every bit as easy as any consumer app that we use today, but it's got to connect to the provider, and that's a big challenge. The integration's high. The perfect use case for a decentralized app is just that. A consumer-driven approach to sharing health data across multiple providers that's not bound to a specific vendor of EMR or not bound to a specific health system. That is patient empowerment. So as far as how we're approaching the market, we're starting with a two-prong approach. This is live now in multiple clinics, and essentially, Health Here is leveraging this kiosk as a front door to the consumer patient. The clinic kiosk makes it easier and faster to check in with the doctor, so it's a clear win-win for the patient and the providers alike. But just getting rid of that clipboard is not enough. We want to promote the adoption of this mobile app. ClinicQ is going to be a way to build trust with new patients and show them that healthcare can be easier. So what we're watching here is a flow of capturing all the demographic and insurance, allowing for point of service payment, all the social, family, and medical history, medications, and signing of all the consent forms. That 9 pages of documentation that patients get greeted with a clipboard every time they visit. So with that, I'm going to flip over and I'm going to show you ClinicQ. This is ClinicQ. So to set this up, I'm a new patient. I got queued to download this app, but I didn't really know what to do it until I went and checked in. I scanned the code, I saved my account, I call out to Blockstack, I'm going to push to auth, and now we're going to use a user ID that's linked to a subdomain, and we're going to authorize the saving of my health summary. So now that we've committed, I can view my health summary from my mobile app. So that's cool to get started. And so the challenge is just getting adoption. So let's go to the next use case. 6 months down the road, I've got another appointment with a different provider. So I'm going to go see my dermatologist. Now I can pre-check through a prompt, and I can just go and review, but it recognizes that my insurance went out, expired in the interim. So I scan my insurance card. We'll grab that image. We OCR the card, and we pull the benefits, and we'll store that updated data. But now, because I've already stored that record and recalled that health summary, I can elect which part of my summary that I want to share with that provider. And let's just say I've got a procedure I just don't think that physician needs to see. So we take that, and we now have a pre-check that's complete, and I pass it into that kiosk, verify the summary, and we've committed, and we've taken what may have been a 30-minute event and turned it into a 30-second event with a securely stored and transferred health record. That's ClinicQ. Thank you.